Hi, I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. Yesterday I made a short video talking about why do celebrities have an unusually high rate of Lyme disease. Well, today I want to talk to you about a much more important topic, and that is why do celebrities keep feeling the need to go public and give advice about cancer treatment. Well, first I want to give you some data. 618,000 people are projected to die of cancer in the United States in 2025, according to the most recent estimates published by the American Cancer Society. The leading cause of cancer deaths in both men and women is lung cancer. Lung cancer is responsible for nearly 2.5 times more deaths than the second-ranking colorectal cancer and third-ranking pancreatic cancer. For men and women aged 50 years and older, lung cancer remains the top cause of cancer mortality. In women younger than 50 years of age, breast cancer is the leading cause of cancer deaths. But overall, lung cancer far surpasses all other cancer types in both sexes when considering all ages. So social media has democratized health information, but it has also enabled unqualified influencers and celebrities to disseminate dubious medical advice. However, when it comes to cancer, it can be downright deadly. Take the case of former supermodel Elle Macpherson. Last year, she went public with her breast cancer diagnosis. She revealed that she was diagnosed with breast cancer in 2017. She goes into some detail in her new book, Elle, but she doesn't elaborate on a lot of the specifics with detection, diagnosis, and treatment. But what she does explain is her decision to go against traditional treatment in favor of a holistic approach. Her unconventional path, however, is not and should not be for everybody. Here's the problem. She did not have invasive breast cancer. She had ductal carcinoma in situ, also known as DCIS, and did have a lumpectomy, which is the primary treatment. Then she detailed how her doctor recommended a mastectomy, radiation, chemotherapy, hormone therapy, and breast reconstruction. Well, I can assure you 100% that for DCIS, no doctor would ever recommend a mastectomy unless it's all over and unless it's invasive cancer. Nobody would ever get chemotherapy. She also states that she had 32 separate consultations with doctors to get their opinions. And pretty much 31 of them said the same thing. But she decided to go with the outlier. Now the question, does that seem normal to you? Would anybody ever get 32 consultations? And the answer is no. Apparently, she had already adopted a holistic approach to her health and wellness, and she said she relied solely on those practices to treat her cancer. Okay, but what did she do? And how did she cause harm? Well, she misrepresented how cancer should be treated and has now created a difficult situation where many women who do have invasive cancer are not choosing the right care or standard of care, which may affect their hope of being cured. To me, this behavior is shameful. She's entitled to make any decision she wants, but to misrepresent the truth and then to go public like she did is just morally reprehensible. Contrast this with one celebrity who did go public and talk about her journey with what is called micro-invasive breast cancer, which is kind of a new concept. Before I did this video, I actually talked to this patient, who's my patient, Daniel Fishel, who played Topanga on Boy Meets World, and I asked her if I could talk about her. She was very encouraging because her goal is to spread the truth. After she was diagnosed and spending much time in deliberation, she came to the best decision for her based on the best available medical information, and she has gone out of her way to go public and educate women about the right choices and how to make those. She is one of the rare outliers that has used her notoriety and fame to be a positive influence. So what's the take-home message? The take-home message is please don't listen to a non-medical doctor or celebrity about how you should treat any medical illness. And especially when it comes to cancer, go seek out a board-certified oncologist or medical doctor who is able to present you with all the options, and who will listen to you and care, and then can individualize a treatment plan based on the best evidence and what is best for you. So with that, thank you for listening. I hope you have a great rest of the week. For any questions, you can go to my website at www.paladinmds, and thank you.